I suppose there's electronic health records, which is usually taken to be the clinical data that hospitals and general practitioners record about patients. I personally would like to take it wider in terms of including the information that patients themselves may have about their daily lives, how they perceive conditions, because after all, probably only about 10% of most of the treatment for a condition actually occurs in hospital or with the GP. Most of it is about what the patient experiences. And I think if we don't include that within this wider context of healthcare data, we'll be missing a lot. But I think the main area that using healthcare data wisely can do is actually, we wouldn't want a surgeon to operate in the dark. I dread to think the consequences, but really what happens at the moment is much of the healthcare services, the healthcare providers, individual clinicians even, are effectively operating in an information dark, rather than actually being informed about how well they're doing, good practice elsewhere that other clinicians may have, how their performance compares with others, and how organizations compare. Too often things are done by one organization, but are not shared with others, because they're too busy doing their own thing. So there's a huge question about using the data to provide us with information about what's good, what's bad, how to generate knowledge for that, and how to share that knowledge more widely. So I think the potential is huge, and I certainly would like my surgeon to be operating with the lights fully switched on, so that's what I'm looking for. I think this comes back to, we're asking both hospitals as data providers and them as proxies for patients and the public to share sensitive medical information in a very controlled environment. But before you'd embark on such a thing, you want to know that the organizations you're working with are trustworthy, they know what they're doing, they have ways of looking after it. You wouldn't want to just present it to the first person coming to your door. You want to know they're established, people are checking them, they check themselves. And this is very much what governance is about. So it's about providing the both technical and organizational processes to help make sure that the data is used as we promised it, used safely, used carefully, but really with a strong sense of stewardship. So not only are we looking after it, but we're making use of it. And I think too often what happens with privacy and confidentiality, we talk about we must protect the data by not using it. And I think that's the worst thing. So that's where, in order not to see anything horrid, we keep the lights switched off rather than having them switched on so we can see what's happening. But part of that transparency is being transparent about how we look after the data and how we protect it. And that's really what the governance is about, is surfacing that, saying this is how we do it, this is what you should understand, and this is what you can take us to task about if we don't do it. So I think that's all part of the openness, I hope. I think the key thing is really in the same way as we say we want, or I say we want surgeons to have the lights switched on. So I think it's important that actually we have the lights switched on in other senses. So that actually where one European project comes up with something that hopefully raises the light levels, that we can share it with other projects. So out of the EHR 4CR project, we came up with an information governance framework, and we've come up with various principles and standard rules that we think should apply in that context, and would like to make use of that through the Institute to actually share more widely with other projects and projects going forward. So what we're keen to do is that what we've learned gets passed on and reused as well. So it's very much the parallel that we use the same information that we've gained again rather than forgetting about it and having to learn it all afresh.